Good morning, Queensland, and good morning, Toowoomba. Well, it's a bit windy and cold up here today, but that's good. So I'm pleased to report that we've had 0 community cases in Queensland today. We've got 2 new cases, but they are in hotel quarantine. We have now 749 people in home quarantine, and we have had 12,733 tests in the past 24 hours, and 21,251 vaccines were administered by Queensland Health yesterday. So that's fantastic news. So today I'm here with the Deputy Premier and the Chief Health Officer, the Health Minister, and also with our good friends John Wagner and the Wagner family, to talk about a really important issue for Queenslanders. Now, we all know that our hotels were not built to deal with the Delta strain of this virus. In fact, what's happening in New South Wales and Victoria is a direct result of the Delta strain coming in and essentially breaching hotel quarantine. So we need regional quarantine facilities. I have been advocating this for a long time. It is a no-brainer. People across Queensland come up to me and they say to me, we agree with you. We don't need people being in hotels, we need them in regional facilities. And how do we know that they work? Well, look at Howard Springs. Howard Springs has been a brilliant example. You've seen our Olympians come back and stay there. It's spread out, it's fresh air for people. People don't have to stay in rooms without balconies. I've done hotel quarantine myself. There is a constant flow of people coming up and down in the lifts. Our hotels were not meant to be the last line of defence to deal with a global pandemic. Now we have agreed with the Commonwealth about Pinkenba. So we've got that agreement and the Commonwealth is building that facility. Well, today I'm pleased to announce that my government has reached agreement with John Wagner, and the facility in Toowoomba will be built. Our cabinet has given the go-ahead, and as you can see right behind us, construction is underway today. This is going to be a great boost for our defence against the Delta virus in this country. And in fact, I believe we need regional facilities right across the country. We are going to be dealing with Delta for some time. And if we want to open Australia up, if we want to open our states up, regional quarantine facilities are the second part of the answer. The first part of the answer is vaccine. So we need the vaccine rollout, and we need to make sure that we have good quarantine regional facilities away from our densely populated cities that can spread the virus rapidly, as we've seen what has happened, unfortunately, in New South Wales and, of course, in Victoria. So the Deputy Premier will go through a few more details. It'll be 1,000-bed capacity. In fact, I've been calling for this since January. It could have been built by now. But we are going to have this facility starting to be up and running by the end of the year, with 500 beds and 1,000-bed capacity by the first quarter of next year. Now, I know the Wagner family and I know John, and when John says he's going to get things done, he gets things done. And you can see by the fact that it's starting today is a commitment by his family and a commitment to the people of this state. This is a commitment by the Wagner family working with the Queensland government to say to the people of Queensland, we want to keep you safe. And the best way to keep you safe and to keep Delta out of Queensland is to build as quickly as possible a regional quarantine facility. And as soon as that regional quarantine facility is built, we are ready to put it to use. So I'll hand over to Dr. Young to say a few quick words, and then we'll go to the Deputy Premier and to John Wagner and then to the Health Minister. Thanks.
Thank you, Premier. So no locally acquired community cases in Queensland today, which is excellent news, and everything we're doing, everything in our power is to stop community transmission until we have got the vast majority of our population vaccinated. So it is critical, please, if you haven't already had your first dose of vaccine and you are 16 years of age or older, book in immediately to get it. If you're 60 or over, with your GP or a local pharmacy. If you're 16 through to 59, book into one of the Queensland health clinics, although there are more and more GPs who are also now able to offer the Pfizer vaccine. That's critical as we go forward. Thank you.
Well, you can see behind us what we've been saying all year, that we have the perfect location for a regional quarantine accommodation facility. It is buffered from the community. It is a greenfield location but ready for construction. In fact, early works are underway as we speak, and it is adjacent to an airport. It will be the first facility after Howard Springs to be completed and be accommodating returning travellers. The talk about this facility has gone on for too long, and the Premier gave me a very clear instruction to get it going, make it happen, and that's what we're announcing today. 500 beds will be online by the end of the year, growing to 1,000 by the end of first quarter next year, and that will be added to then by the Commonwealth Government's Pinkenbar facility, another 1,000 beds by around the middle of the year. As you've heard, our hotel quarantine capacity is currently stretched with more than 5,000 people, and that just underlines the need for us to have facilities like this. We do hope that flights will be able to land here at the adjacent airport. The media that travelled with me will have seen just how convenient that airport is. We would expect that once the facility is built, we will have support to be able to do that. We do know that airlines and crew are happy to fly in here, and we do hope that once it's built and once the heat is out of the issue, that the Commonwealth would support that. But if not, we currently bus arriving travellers from Brisbane to hotel quarantine accommodation on the Gold and Sunshine Coast, and so that would remain an option to get people here safely. The design and operation will be very closely modelled on the Howard Springs, the very successful Howard Springs facility. It will be purpose-built based on the learnings from that facility. Therefore, the infection control can keep our staff, the other people in the facility, as well as the local community safe, in fact, much, much safer than non-purpose-built hotel quarantine accommodation where we currently have people. There will be a mix of single, double and family accommodation in cabin style with balconies and, importantly, no hallways adjoining rooms which we have seen as vectors in hotel quarantine for the virus. While we continue to work through the details of the health and policing model that will be implemented here, COVID positive patients who require hospital care will be treated in one of the 5 COVID hospitals that we currently use, that we currently transfer people to. By funding this facility ourselves and building this facility ourselves, we can ensure that it replaces current hotel quarantine usage. That will allow us to take travellers who are currently within the cap and put them into this facility, reducing the need for hotel quarantine. I want to add to what the Premier said about the Wagners, and particularly John Wagner's support for this facility. They really do care about the Queensland community and see this as one way they can support the community and help us in the effort to address COVID-19, and we certainly welcome that. There have been times throughout this process where it would have been easier for them to walk away, but they haven't. They've continued to work with us, and now we've achieved this very important milestone. The financing arrangement will be commercial in confidence, but I can confirm that we have an initial 1-year lease with options of extending that to 2 and 3 years. When you consider that the last lockdown alone cost more than $1 billion in economic impact and compensation, you can see just what fantastic value it will be if we can avoid just one lockdown, let alone more with this new facility. So the work has started now. It's time for the politics to end. The facility will be built. It will be a purpose-built facility. It will provide a great service to the Queensland community, and as the Premier says, we actually need more of these facilities.
Thank you, Premier and Deputy Premier. First of all, I would like to thank the Queensland Government for having the confidence in us to go ahead with this facility. And I would also like to take the opportunity to congratulate the Queensland Government for keeping Queenslanders safe. And I think the fact that we're going to move ahead with this facility, which was mooted a long time ago, and as the Premier suggested, it could have already been built and operational. But as the landlord of this facility to the Queensland Government, we are working through the final design criteria to make sure that we have the best fit-for-purpose regional accommodation facility for return travellers that there is in the country, or in fact the world. So this is going to be a great economic boost for Toowoomba. It will create a lot of local employment. Our local producers, just by the fact that we have to produce 3,000 meals a day, will really benefit from this, and it will help get Queensland out of COVID and on the road to economic recovery, which we desperately need. So thank you to the Queensland Government, and congratulate them on actually getting this to a fruition. Thank you.
Well, this is a great day. We've been calling on this for months. And if this had been built months ago when we first asked the Commonwealth to partner with us and the Wagners, we potentially may not have had to make the very difficult decision that we made yesterday to pause people domestically coming into hotel quarantine for a couple of weeks. But now we can move forward, and we have this great facility that is already construction underway. As the Deputy Premier has said, most of our transmission that has occurred within our hotel quarantine has occurred through those corridors, closed in corridors. We know that is a very high risk. We know our hotels are not built to be quarantine facilities. We know that when you build dedicated facilities like Howard Springs, that you significantly reduce the risk of transmission and exposure for our community. So this is a great day, and I'm thrilled to be part of the Palaszczuk government partnering with the Wagners for this. Can I say a big shout out to our vaccination teams? Another record day yesterday, over 21,000 vaccinations that we did. As the Premier said, 21,251. So that is fantastic, and 12,733 tests. I do want to comment very briefly on Palm Island. We did have positive sewage showing up in Palm Island. Now that could be just someone who is shedding, who has had the virus previously, but we're not aware of anyone on the island who is a former positive case. So what we have set up starting this morning is extra capacity to ask every person on Palm Island who has any symptoms whatsoever to come forward and get tested, so we can rule out that there is any positive cases there and any transmission happening. This morning, the Townsville Hospital and Health Service flew over an extra 6 health staff, 3 nurses and 3 admin staff to support the existing vaccination team there. And those additional staff will be there for today and tomorrow, and we'll work out what capacity we need over the weekend. But anyone who has been to Palm Island recently or is on Palm Island who has any symptoms whatsoever, we do ask you come forward and get tested, just so we can make sure we're protecting the community. I note New South Wales is now up to 14,673 cases in that cluster. That only started 2 months ago, so the extraordinary numbers. And I can now report that we expect to hit 50,000 vaccinations at our Brisbane Convention and Exhibition Centre by the end of the day, and we only started that 2 weeks ago, so well done to all of those people as well. The last thing I want to say about why this facility is so important, the Doherty Institute has been talked about a lot, their modelling recently. Their own report says we will need to keep some public health measures in place. Test, trace, isolate, quarantine. So even with high vaccination rates, we must continue these public health measures, which means we will continue to need quarantine facilities, and we need to make sure they're purpose-built and they're keeping our community safe.
Premier, when this plan was first put to the federal government, some of the hesitancies from the federal government were the fact that Toowoomba Hospital couldn't handle an overflow of sick people. Just listening to the Deputy Premier there, to clear things up, the plan would be, if there was an overflow of people that were unwell, they'd be then
transported or airlifted, whatever. We will transport them to the COVID-equipped hospitals in Brisbane. So that's the commitment we've given to the people of this region. But this could have been built by now. I mean, we've got to get on with this. It is a race. This is a race. We are up against a highly infectious Delta variant that's sweeping the world. We don't know what's next. We need to get these facilities up and running. And everybody has seen how successful Howard Springs is. So, you know, you've heard the commitment from John. This is going to be better than Howard Springs.
Why didn't you just go it alone 6 months ago then?
Sorry?
Why didn't you just go it alone 6 months ago then?
We had to work through the proposal in detail, and our Cabinet has now committed to this partnership.
Premier, will this be for both domestic travellers and international travellers? And why should they have to quarantine if they've been fully vaccinated in the future?
Well, as we know, and I was fully vaccinated, and I came back from overseas, and I did the 14-day mandatory hotel quarantine, you can still transmit the virus. So, you know, hopefully over months and years we might get to a better position on the international evidence, but at the moment the 14 days will stay. And having personally done hotel quarantine, can I tell you, you know, you are in, across from you are people, beside you are people, you've got people delivering, you don't have the fresh air that, you know, John was talking about and the DP was talking about. This is a no-brainer. This works in Howard Springs. These are the model facilities that the Commonwealth should have built by now right across the country.
Premier, would you consider allowing fully vaccinated people to quarantine at home, and if so, when?
Look, we addressed that yesterday. We are looking at some preliminary work that's happening in other states, and we'll see how that goes. Yep.
Premier, yesterday with that announcement, there was some 5,000 people have talked about in hotel quarantine. This facility will go 500. Can I ask how that alleviates the stress on police and nursing? Are we going to have to see a cap here in Queensland further down the track?
My understanding is that there's less police and nursing that are actually needed when you have a purpose-built facility, and there's quarters for them to actually stay near the facility as well. So what you don't have is you don't have people travelling from all different parts of the southeast coming in and out of buses and trains, which then cause your lockdowns in your capital cities. So it actually makes really good sense about having them set up.
Will this, with the addition of Pinkenbar as well, will that mean you'll fully eliminate the need for hotel quarantine?
Two are definitely better than one, and that would mean that we would not have to use, I would expect we would not have to use hotels.
You've signed on for a year long from December.
With options for extensions, yes.
Right, so how long in your planning do you think this is going to be required? Because point is there are people are being vaccinated. Countries around the world are just requiring that arrivals be vaccinated and tested. Why isn't that enough? And is that the right signal to send to people wanting to come back to Australia or come to Australia?
Look, Michael, that's a really good question, and I think what we've seen is that there are people that are wanting to return home, and I think the more facilities we have, the safer it is for them to return home and get home. I understand the frustrations of families having loved ones overseas and seeing what's happening overseas. There would be a lot of people who'd want to come and be reunited. Also, too, we've seen what's happened in Afghanistan with the urgent need for retrieval and to bring people back to Australia, and I know that Queensland is taking 2 plane loads. We've increased that from 1 to 2. So I think there are these ongoing needs to actually have these types of facilities.
But why do you need this extra level when people who are coming here or can go to other countries and all they have to be is test negative and be vaccinated? Why the extra layer of protection?
Well, I think you need that extra layer of protection because, you know, Australia has done such a great job in terms of controlling the virus. I mean, for a long period of time there, we were the envy of the world. And, you know, our hope, and I think the hope of the nation, is that New South Wales will get on top of their current outbreak, Victoria will get on top of their current outbreak, New Zealand will get on top of their outbreak, and then, you know, we'll actually be able to have that freedom of movement of travel again. And then I would expect that countries where they have done well, then, you know, that would be the next course to open up to them.
But if you're you're talking about the road to economic recovery.
Yes.
You're adding this extra layer. So tourists wanting to come here, or university students wanting to come study here.
Tourists, university students, seasonal labour force as well.
There's an extra burden.
I was adding an extra category.
There's an extra burden of cost to university students to quarantine, to tourists wanting to come to Australia. So how does that reconcile with your so-called determination of road to recovery?
Yeah, but I think but this is the national requirement for the 14 days mandatory hotel quarantine. No one has moved beyond the 14 days mandatory hotel quarantine. That's a national cabinet decision. And AHPPC.
Why can't taxpayers find out how much it's going to cost?
I'll tell you, it's a lot cheaper than Pinkenbar.
Well, how much is the state?
Sorry?
How much is the state chipping
Well, it's commercial and confidence at the moment, but it's a lot cheaper.
Premier, fast forward 6 months, say we've gone a long way to eradicate this, and we're starting to get on with our lives. We're building this. What are we going to use it for if we don't need hotel quarantine? Is there going to come to a point where Queensland says we don't need hotel quarantine? Does this facility rot? Or?
Well, 6 months ago, did we think we'd have the Delta strain? Did we think that the Delta strain would be, ripping through the world? I mean, have a look what's happening in the US at the moment, everyone. I mean, you've got the pandemic of the unvaccinated, and now there's such concern about young people. So in the States, you only have to look at the reports that are coming through about hospitals being overwhelmed, and now not just by adults, by children. Okay, so this is a real concern. So, you know, we were concerned about the UK strain, 6 months ago, and now we're dealing with a highly infectious Delta strain, and look what's happening in New South Wales.
Say there is a point we don't need it. Say we get to a point where we're vaxxed.
I'm quite sure that there's other ways that you can use the facility. I mean, just like Howard Springs would be put to other use as well.
But it goes a long way to suggest that we are a long way from hotel quarantine being quashed completely here in Queensland.
I think hotel quarantine has been one of the... It has been an initial defence against the virus coming in. That was one of the earliest decisions that National Cabinet and AHPPC made, and it was one of the best decisions this country made. It really was, because look how well we weathered that storm, the pandemic storm, for such a long period of time, because we were requiring this. And then other countries looked to Australia, and then they started putting in the mandatory hotel requirements. And those countries that don't have it, people who are vaccinated can still transmit this virus. And we are still seeing, like today, 2 hotel quarantine cases of people who are coming into Australia, coming into Queensland, who are testing positive.
Have you spoken to the Commonwealth about this facility in the sense that there's...
With the federal government. Has that been resolved? Are you allowing international flights into Wellcamp then?
Well, we hope so. So we'll be continuing those discussions with the federal government. But we can bus people from Brisbane up here if we have to. But I think, you know, it's a no-brainer. Here's the airport. Send the flights in here. It's safe.
Does the Prime Minister know?
Sorry?
Does the Prime Minister know about this announcement this morning?
Quite sure he does now.
So how would you...
sorry? You've all heard about it at the same time I'm talking to you about it, okay? So, you know, you're all getting it live at the same time.
So the Commonwealth
is going to...
Sorry?
So the Mayor doesn't know?
Well, I haven't spoken to him. The Deputy Mayor has spoken to him.
Premier, how can you guarantee that you're going to have the domestic flights coming in here and the international flights? Will there be... Surely you're not just going to bus everyone into this facility? Or
no, we're hoping that we'll be able to utilise the airport. So we'll continue those discussions, but we will use whatever other options are open to us. We will put this centre up to good use. Queenslanders want this centre utilised. I have listened to Queenslanders. I know how much they support a regional quarantine facility to be in Queensland. They want their community kept safe. That's what they're saying to me, and we are delivering it.
The Commonwealth has still got approval over who arrives in Australia, so how can you not have spoken to or told the Commonwealth at least that you're going
We've been
ahead?
having ongoing discussions with them for a long time.
Okay, but how can you go ahead with this, given that they're the ones that have got to give approval to the arrivals, and they've got to be happy with the quarantine facility?
If you build it, they will come.
But what if they don't, though?
If you build it, they will come.
But if they don't, Premier, that's the question. If they don't,
Well, you
come
go and tell the families that have stranded Australians overseas, right? That you have a facility here that can take them. You go and tell them.
The Commonwealth set criteria.
If you build it, they will come.
The Commonwealth set criteria.
Well, they set the criteria to suit them.
Right.
Are people going to be transported if they have COVID by ambulance back to Brisbane?
Or airlifted.
Okay, is that not a waste of resources
No,
considering how many?
not at all.
Premier, what do you say to the people that campaigned against this project, including Clive Berghofer?
Look, what I say to the community is this is about keeping you safe. And I want to thank the community. I mean, every time that we've asked the community to respond, they have done an extraordinary job. And every day I'm absolutely amazed at the resilience of this state and its people to actually do the right thing. Every time we say, you know, wear a mask, stay at home, they're doing it. Everyone's doing it.
But are you confident that if there's a local outbreak here, there'll be the resources locally to deal with that?
Absolutely. Yeah.
Who makes the call? So you start, say, with 500 beds later this year, and
then it increases to the first quarter of
Who makes the
year.
call on who's going where with people coming in, like to Brisbane, like you say? Who makes that decision on who goes where? I guess to hotels or to here.
Well, at the moment there's caps on how many people can come in, so we abide by those caps. But lately the Commonwealth has actually been sending in flights above those caps, and we've still been accepting them.
Do you think it's going to deter people from wanting to travel to Australia if they have to come out here and quarantine?
Well, they've been coming now. So, you know, I honestly think that you know, people are still going to be travelling for specific reasons. People are coming here, returning home for the sake of their families, but also too, I know personally people who've come home with very ill relatives as well to see them before they pass. So there's a whole range of reasons that people still do need to travel. Significant, serious reasons.
It's going to be the same cost as hotel quarantine?
That's my understanding. DP might be able to elaborate on that.
Yeah. And can I ask you about National Cabinet?
Yeah, sure, Michael.
What's your view on including the 12 to 15 cohort in the 70 and 80% modelling for staged opening up?
Okay, so for a start, I'd like to see the modelling before National Cabinet tomorrow. That would be fantastic. We've had a lot of talk in the media this week. You can't expect National Cabinet to make a serious decision tomorrow if you haven't seen the modelling. So I'm really hoping, sorry, the wind's just, we really need to see that modelling. So as soon as the Prime Minister gets that, I'd hope that he would circulate that. In relation to your question, which is really important about the 12 to 15-year-olds, I think what we're seeing as evidenced in the US, the fact that it is the pandemic of the unvaccinated and the young people are getting it. We need to get the extra advice from the Doherty Institute about the impact on young people and the rollout of that vaccine. Now, to roll that out, I think an easy way to do that is, of course, once again, either through your GPs, your vaccination hubs, or even through the schools. But secondly, the supply. We need the supply if we are going to vaccinate our young people as well. So, I really do need to see that modelling as quickly as possible. I think every Premier and Territory leader would like to see that, and I don't think it can just be dumped on us in a cabinet meeting. I think that's, you know, for good decision making, we need to see it and need to understand it. And I'd like to take the advice of my Chief Health Officer. I'd like to discuss it with some of the senior members of my cabinet as well. I mean, we want to make serious decisions here in the interest of the whole country. You can't just make a decision by it being dumped on you. At the moment, all I've got is a blank page.
The Doherty Institute's come out and said that the modelling that they've done so far around the 70 and 80% targets still holds up in the context of this current caseload.
But they're going to do more modelling, so I want to see the modelling. It's just a very simple ask. Let's see it before the cabinet meeting.
Premier, this morning
Yes.
the restrictions on people that can cross the border has tightened yet again.
Yes,
Some caterers
yes.
and engineers and things from hospitals not considered as essential to cross over the border. There's an oncologist that has spoken this morning to some news outlets saying that this decision will cost lives. Your reaction to that?
In relation to health,
Yeah, some engineers and caterers and things like that can't actually get to work this morning. An oncologist has
if
actually
they're an
said-
essential worker, they can. If they've had their vaccination, they can come across the border, and we're happy to work with people. Yeah, and no one refuses health, so Dr. Young's addressed that yesterday. Yeah.
Queensland still lags behind in its vaccination rates, 3 and 4% to the national average. Why is that, and what can Queensland do to lift that pace?
Yeah, I think what you're seeing is higher vaccination rates in New South Wales and Victoria. A, because they've got outbreaks as well. I think that always gets people to go out and get their vaccination. And our vaccination is increasing. I've had a thorough briefing from the Deputy Commissioner, who's our vaccination coordinator, and he assures me that it is ramping up at the right level, and it is in accordance with the supply that we are getting. And he's shown me some graphs about some of our vaccination went down because we didn't have the supply, and now we've got the supply, it's going back up. So also too, like, you've got to think about this, Queensland is such a decentralised state. I mean, we've had to vaccinate people up in the Torres Strait, up in the northwest, out west, small communities, out across our border communities, across regional Queensland, and now we're getting into where the workforces are. We were out of that distribution centre this week. We're setting up more vaccination hubs. We've looked at where some of the vaccination rates should be a little bit higher. I'm looking through all of that, and we're pushing out the vaccines in those areas. And we've got a couple more communication campaigns about to start as well. So once again, can I please stress to Queenslanders, now is the time to put your name down and go and get your vaccine.
Premier, once this facility is built, is there scope for further facilities in regional Queensland? I mean, is Gladstone back on the table now if you're planning to build more?
We haven't put Gladstone in the mix at this stage. We want to focus on getting this one up and running. And like I said, everybody knows how successful Howard Springs has been. I think Howard Springs has been the gold standout, the gold standard, and it's also held all of our golden Olympians. And I just think it's a great example of what should be across the nation.
Should Calliope be considered later though?
We'll have to assess the need. I don't think at the moment, but if the need is there in the future, we'll have those discussions.
It's already built.
Yeah, but it's a bit more remote to get to and everything. It's a bit. This is just perfect. Like
Marginal
this is like
seat.
a perfect. Sorry, no, not at all.
It's,
No.
do you have any idea of how many jobs will be created during construction? and
Yes,
then how many workers
around.
you'll have?
My understanding is between 400 and 450, which is fantastic. So that's local employment as well out here, which is fantastic. And yeah, and as you can see, early works, and then we'll get stuck into it.
And then to run it, how many people would you potentially need?
We'll get those details for you. Yeah.
Could this be an accommodation hub for the 2032 games?
Oh, that's a good idea. Now you're talking.
Is your health department planning to look at possibly ramping up the Toowoomba Hospital?
What do you think,
to
John?
accommodate-
2032?
It'd be fantastic.
We'll be having some events up here. I think that's a great idea. There you go.
Is your health department planning to potentially ramp up their facilities at Toowoomba Hospital to accommodate for COVID patients, given they're here, rather than if they were critical?
No, because what they do in Howard Springs, they have a separate area where they actually deal with the people, and then if they're serious, they then get transported or airlifted back to their respective states. What we've said is we will not be transporting them to the Toowoomba Hospital. We will make sure they go to where our COVID hospitals are. We'll transport them.
Not things like ventilators that would be
Sorry?
kept at this facility. Things like ventilators, especially.
The Chief Health Officer will look at all of that, the way that with the designs.
Premier, we've seen cases in hotel quarantine of people escaping. You know, they take off into the community. It happens here. Toowoomba's the closest town, and we do see a Delta outbreak in Toowoomba. Could you see how there are concerns from residents that Toowoomba couldn't handle something of such?
But I don't think there's been any real issues like that. I'll talk to Michael Gunner. I don't think there's been any real issues like that in Howard Springs. So look, let me tell you, I would have preferred to have done hotel quarantine in an area which has a nice balcony. You can sit out there. You've got your own little area that you can sort of do your self-catering for, whatever. Then stuck in a room where you can't exit the door.
I'm not disputing that. I'm just sort of asking the question. If hypothetically, if someone does escape, we see it. If someone does
but
escape,
you're going to have police here on site.
Yeah, that's
and surveillance and all of that.
We've seen them slip police, Premier. With all due respect, we've seen them slip police. It's that people are concerned in Toowoomba.
Yep.
That if this happens, that
yep, and we'll make sure that that the police will communicate with the public to actually ease any of those concerns. I think they'll do that.
Dr. Paul, can you ever see a point in time where quarantining arrivals won't be needed?
That would be lovely. I think we all would dream of that day. We all dream of the day of where we would like to go and travel overseas and see friends and family, or, you know, I think everyone dreams of that, where there's freedom of movement, there's no lockdown. Everyone wants to go back to the life we had. Everyone does. And I think we're trying to do everything we can to get to that point. But there's a lot of work to be done. Get the population vaccinated, have these regional quarantine facilities, and have back some normality.
Dr. Paul Griffin, who is doing was
yes.
going to report on your
yes,
on the outbreaks in the hotels. He's been critical in an interview with the Australian, saying that he says part of the blame in terms of the lag in vaccination rates in Queensland was the messaging that your government had in regards to AstraZeneca, and essentially warning off the younger people from taking that particular jab. What's your response to that?
Look, Dr. Young went through that in quite some detail yesterday, and she went through the ATAGI advice. And what we are seeing is people taking up a range of vaccines. They are taking up the AstraZeneca, they're taking up the Pfizer, and I'm really looking forward to knowing when Queensland's going to be getting the Moderna. I think this is really exciting to have a third vaccine that people can choose from. My understanding is in the States there's about 3 or 4 vaccines. You go and see your GP and you discuss which one is best for you. So, you know, I can't wait till we get the extra vaccine.
In terms of people having to reapply for their border passes and coming back into Queensland,
yes.
the new thing, how long do you think that they should be waiting, or how long will they be waiting to know that they have a hotel quarantine spot?
Well, they're setting the system up now, so we said there's that 2-week pause, so hopefully we'll iron out all those issues over the 2 weeks. But like I said the other day, you know, we were at our capacity. Queensland was being loved to death, so we need that pause to get those numbers right down.
Do we have any capital costs in this facility? When you guys were openly talking about the breakdown of this, the Wagners were going to stump up for the build, and you were going to do operational. I know you don't want to talk about because of commercial and confidence, but is that still about the same fit?
Yeah, about the same fit. Yeah. Operational.
All right, last one, guys.
Tomorrow, Friday, with restrictions set to ease. Maybe
Yes.
Dr. Young can talk about what South East Queensland is.
I think we're going to be talking about that tomorrow.
Might give us a hint.
No, tomorrow. Tomorrow is a brand new day.
Thanks, everyone.
Tomorrow is a brand new day. Anyway, thanks everyone. Thanks to all our Facebook Live listeners as well. Thanks everyone for coming here. And it's warmed up now. Just perfect.
Premier, we'll just pop over to you.